washing my hands. Hi, how are you doing today?
I'm good. How about you?
I'm good. My name's Amy. I'm going to be your student nurse. I'm going to do a bedside assessment if that's okay with you. Are you in any pain right now?
No.
No? Okay. So first of all, can you tell me what your name and your date of birth is? I'm going to check it against your wristband.
Allie Antonucci, and then January 6, 2001.
Okay, perfect. And do you know where you are?
Bedford, Maine.
And do you know what time it is?
11:40.
Okay, and do you know what day it is?
Thursday.
Okay, so my patient is alert and oriented ×3 to person, place, and time. I'm then going to check your pupils. So I'm just going to have you stay looking at my nose. I'm going to shine a light into your eye. Good. Good. And I'm going to have you pay attention to the pen light itself as it comes closer. Okay, so our pupils are equal, round, and reactive to light and accommodation as well. And then her speech is clear and non-slurred. And I'm going to move on to your cardiac system. So I'm going to start by listening to your heart. Okay, I'm going to start with your aortic in the second intercostal space on the right side along the sternal border. Move over to the left side to your pulmonic in the second intercostal space along the sternum border. Then the Erb's point, which is the third intercostal space along the sternum border. Then the tricuspid, the fourth intercostal space along the sternum border. And then the apical in the fifth intercostal space. Okay, so her rhythm is regular. There's no murmurs, gallops, or rubs, and the S1 and S2 were both noted. I am then going to check your capillary refill, and she does have nail polish on, but it's close to the nail bed as I can get, and it is about 2, which is regular. I'm then going to check your radial pulse. I'm going to do it with both hands on both sides to check symmetry. So it is regular and 2+ and symmetrical. I'm then going to move down and check your dorsalis pedalis. And again, 2+ regular and symmetrical. And then going to your posterior tibial. And 2+ regular and symmetrical. Then I'm going to check for any edema. And there is none noted. So I'm going to move on to your respiratory system. So I'm going to listen to your lungs. As I move my stethoscope, I'm just going to have you take a deep breath for me. Okay. Go ahead. Okay. Good. I'm going to do it posteriorly as well. And avoiding the scapula. Go ahead. Okay, and lastly, the 2 sides. Okay. All right. So your breaths are equal bilaterally, unlabored, anteriorly, and posteriorly. Have you been coughing lately?
No.
And if you do cough, is there any sputum?
No.
No? Okay, good. So next I'm going to move on to your GI tract. So I'm just going to have you lay down for me. And I'm going to inspect if your abdomen is distended, which it clearly is not. I'm also noting that her bladder is also non-distended. So I'm going to start by listening to your vowel sounds in all 4 quadrants. Okay, your vowel sounds are all active. I'm now going to palpate your abdomen. Please tell me if there's any pain. Going in all 4 quadrants, I'm going to lightly palpate. Is there any pain?
No.
Okay, I'm going to go a little bit deeper again in all 4 quadrants. And any pain?
No.
No. Okay, and you're welcome to sit up again. And do you follow a normal dietary routine? Okay, and do you have any nausea or vomiting lately?
No.
And when was your last bowel movement?
About 3 hours ago.
Okay, and then what's the consistency? Was it soft or hard?
Yeah, it was relatively soft.
Okay, and is it regular for you in color and
Yep.
size and all that?
Yep.
Yes, okay, good. So now moving on to your GU, do you pee regularly?
Yep.
Okay, and is there any foul smell to it?
No.
No, is it cloudy or clear?
Clear.
Okay, and then what color usually?
Yellowish clear.
Okay. And is there any burning or pain when you're going to the bathroom?
No.
No? Okay. And noted before when I was inspecting her abdomen, I noted that her bladder was non-distended as well. So I'm going to move on to your musculoskeletal system. So I'm going to have you just push up on my hands. Okay, push down on my hands. Good. And then can you squeeze my fingers? Good. Crack your knuckles. There you go. So by having her squeeze both my fingers at the same time, it checks symmetry of her strength. I'm then going to have you push up with your knees. Okay. And I'm going to have you push up with your feet. Okay, and push down. Good. And noting all of her extremities are equal bilaterally, upper and lower extremities. There's also no swelling noted. And so then I'm going to move on to the integumentary system, where as I was inspecting, her skin was warm, dry, and intact. There are no open wounds or incisions. Her skin turgor is good, and it goes down quickly, which means that you are hydrated. I believe that is everything. So I'm going to make sure that her bed is in the lowest position, that her side rails are up, and that your call bell is right here. And can you show me how to use it?
You just press the button.
Okay, good. Do you have any questions for me?
No.
Okay, great. Thank you.
Thank you.